Hello, welcome to a pre-learning module for the upcoming training of trainers for supporting self-disclosure of HIV status, a course we will be conducting in Ho Chi Minh City, April 9 through 12. I'm Greg Malhoff, and I'm with the California Prevention Training Center, a program of the University of California, San Francisco. This module is intended to provide an understanding of the lives of men who have sex with men and transgender women. Understanding the culture of these two groups is important to help assure providers are providing sensitive and successful services. These groups are the most impacted by HIV, and much of that is because of societal pressures. The pressures may contribute to elevated risk and therefore higher rates of infection. In this module, we will build on any of your current understanding. We assume that you have some level of understanding, and hopefully this will enhance. Also, this will be delivered in a more brief version during the training of trainers, and some of you will be asked to conduct this particular module in its shorter form. So it's important that you pay close attention to this. We start from a place of believing that everyone has a level of understanding and sensitivity for MSM and transgender women. And what we have found in our work over time is that people often believe they are sensitive, and sometimes they learn from this course and the content that we teach. So hopefully this will be helpful for you. So our goals and objectives. So the goal is to increase sensitivity of providers working with MSM and transgender women, as I mentioned. And our objectives are to increase the awareness of providers' cultural beliefs and values that may impact working with MSM and TGW. To increase knowledge of the challenges that MSM and TGW face, and specifically in accessing HIV prevention and care. We're going to increase the knowledge of stigma impacting MSM and TGW, and increase the skill in assessing concerns to demonstrate sensitivity regarding MSM and TGW. So this is just for you. How sensitive are you? I just want to have you take a few minutes, think about how sensitive you believe you are working with MSM and TGW. So again, this is only for you. You're not sharing this with anybody. We will ask this in the training as well, and it's never necessary to share it, but this is just for you. On a scale of 1 to 10, where 10 is the most sensitive, please rate yourself about how sensitive you are for working with MSM and TGW. And if it's different for those two, then just note that the difference. It's an honest assessment for your own personal information. So the rationale and background, why do we want to be MSM and TGW sensitive? Just to think about that. Why do you think that it's important, in the work that you do? But first, let's just talk a little bit about how we're defining MSM and TGW. So these definitions is what we will use for the presentation and also for the training that we'll be doing, the training of trainers. So men who have sex with men, MSM. Any male identified person who has sex with other male identified persons. So the focus here is on identity, not on body parts, but identity. So this can include both men who were assigned male at birth and persons who identify as male that were assigned female at birth. So basically transgender men. We include in our definition of men who have sex with men, if they're having sex with men. And transgender women are individuals who identify as female, who were assigned male at birth. And again, we're focusing on identity and not body parts here. Okay, moving on. So again, why focus on MSM and TGW? We know that there's a potential crossover with heterosexuals regarding HIV. So men who have sex with men may also have sex with women. Transgender women may have sex with heterosexual men or with heterosexual women. So there's this potential for HIV to cross into the heterosexual population, based on a high rate of incidence in and prevalence in MSM, especially. So stigma and fear decrease access to care. So many people who are MSM or TGW anticipate being mistreated. So they may not come into care or to get prevention services. So societal pressures and stigma, which we will talk more about, can cause us to be anticipate being mistreated. And we're going to talk more about stigma later, but just for information, I say we because I am a gay man, I am an MSM. So much of this content is based on my personal experience, but also having worked with gay men, MSM in general, and transgender women for over 30 years. And in many, many settings, STD, STI screening, HIV testing. I even worked in saunas, doing testing and screening in saunas. So, little aside. And then another reason to be focused here is their priority populations that are identified by CDC Vietnam. And here's some of the reasons why. The epidemic is surging, especially among young MSM in Vietnam, and that's true pretty much everywhere in the world. 47% of newly diagnosed HIV infections in 2020 were among MSM, and the HIV prevalence among young MSM, 15 to 24 years, quadrupled from 3% in 2011 to 13% in 2020. And that's from the UNAIDS 2022 report. The overrepresentation of MSM, again, as I said, is common in many other countries as well. So barriers to accessing services. So what we have found in my work, I've worked all over the world, including the US, that men in general are less likely to access care. So MSM being men may be less likely. I'm not sure how that is if that is true in Vietnam or not, but I have found that it's true in Africa, the US, Thailand, Taiwan. And for instance, in Uganda, when I worked there, many, many men would have their female sex partners test for HIV instead of testing themselves. So they would not go and get a test. They wouldn't have a home test or anything. They wanted their female partner to do that. So think about, is that true in Vietnam or not? So stigma and discrimination based on being MSM or TGW and HIV/AIDS status, or the assumption that because you're an MSM or a TGW that you probably have HIV. So many people just believe that, and that maybe increased stigma on that level. Again, we'll look at this a little deeper. So negative experiences with healthcare. So someone may have had personal negative experiences, or they may have heard of negative experiences, and those whether experienced or heard of can cause people not to access care. If they hear that someone was mistreated, they might expect to be mistreated as well. So cultural norms and attitudes about MSM and TGW, are generally, I know they're improved in many places, but there's still these underlying negative connotations or negative beliefs put on MSM and TGW. And we hear those messages every day all around us, whether it's on TV, people on the street. People use names that are often associated with being gay or MSM or transgender to indicate that it's something bad. So it's all around us. And again, these are kind of normalized in our societies, and we're all exposed to them And a lot of them are just based on a lack of knowledge or awareness. So part of, again, what we're wanting to do is raise awareness and knowledge. So this is from a transgender woman that was in the Saigoneer, um, talking about that there's just not a lot. There's a lot more that people need to learn. So she said there is still so much that both healthcare providers and transgender people themselves don't know. Healthcare for transgender people is such a new thing. So again, we're forgiving ourselves for what we don't understand and what we don't know, and we're looking to learn more about those things. Okay, as again, negative experiences, this is kind of a continuation of that, um, it's detrimental for MSM and TGW, and it can be detrimental for clinics and other services. So if a clinic has a reputation or a provider has a reputation of being insensitive, so that's bad both for the clients, but it's also bad for the clinic, and because you want to be providing services. Confidentiality concerns are a big issue. So many people who are trans or MSM, they may not want to disclose that to everybody. So when they access healthcare, they may fear that if they expose it in the healthcare setting, that it could get out, that someone else might know. So in preparation for this training, and I've done this in other places as well, we sent out a survey to see if we could get some real input from real people in Vietnam about their experiences as MSM and TGW. And I also did a lot of time, I spent a lot of time on Reddit and other discussion forums, Facebook, etc., um, to just to get a sense of what it's like in Vietnam. And one of the big things that came up was not wanting to be outed. So they didn't want to disclose in a healthcare setting because they were afraid that it would get out. And then the other thing is that people may believe that services are only for people who are already HIV positive. And that can come from the way services are promoted, or if it's mostly focused on care, that someone who's negative may not think they can come and get prevention services. So be aware of how your services are being promoted. And so just for yourself, is there a perception among MSM and TGW in Vietnam that services are not MSM or TGW friendly? Just think about that for yourselves. And we'll talk about that in the trainings. Okay, here's the way. Sensitivity building. So we're going to talk about a path to becoming more sensitive. Again, we're starting with that we believe people are sensitive already, and we're hoping that there is still something for you to learn and grow. So consider the following. This is for you, again, for yourself, and we'll probably revisit this in the TOT as well. So ask yourself or answer this for yourself, what do you gain from building sensitivity and providing more sensitive services? How does that help you as a provider? The other thing is what is required to build your sensitivity? What do you think you or your colleagues need to move closer to being a 10, as we asked, in sensitivity? And then most importantly, probably, is what do clients or patients gain from providers being sensitive? So again, think about this for yourselves. We're going to come back to this when we get to the training of trainers. Values and beliefs. So one of the things that is really important when looking at changing our sensitivity is and building sensitivity is to recognize our own beliefs. What we believe about MSM and TGW. We know it can be difficult to change long-held cultural or religious beliefs. Again, as I mentioned earlier, these negative thoughts and negative things that we hear about MSM and TGW are all around us, and so we grow up with those. We get them in church, we get them from our family, we get them in school, so it's all around us. So those can be challenging to relearn or unlearn. And then importantly, you may not have to change your belief. to provide more sensitive services. So finding a way, even if you can't change your belief, to be able to put that aside and see the person as a real person, as a person that needs help, and be more sensitive in that sense. Compartmentalization is kind of what I'm saying. So again, look at this for yourselves on an individual level, and just think about this before we see you at the TOT. So recommendations, I've said a little bit of this already. So build awareness of your own biases. So, take an honest look at that. I guess the way that I like to think about it, or what can be helpful, is, notice the first thing that pops into your head, the first thought that pops into your head when you are working with various people, whether it's a transgendered woman or a gay man. What is the first thing that pops into your head? And just notice those things. Or if you see someone on the street, pay attention to those things. Again, I said, as mentioned before, we can, have our own values, but while still, respecting others, and, not imposing yours on others. I think a really, really important tool is curiosity. So using genuine curiosity to help learn more about, what it is like out in the world for MSM and TGW. Most people are happy to talk about themselves and share about themselves if they are asked in a genuinely curious, respectful way. So just a caveat here is, we want to make sure that the things we're being curious about or asking about, are related to the context of the service that we're providing, not just sort of, random things. So recognize your limitations, know that you don't know. So again, it's fine. It's fine if you don't know everything about MSM and TGW. That's fine. Just like we quoted the woman a few minutes ago, there's a lot providers and TGW don't know. That's okay, and we can all learn. Look for opportunities to build your knowledge and encounters with MSM and TGW. So whether that's in your professional life or in your personal life, look for opportunities to get to know and find out more about what makes MSM and TGW tick. What are their thoughts and beliefs and fears and etc. So let's talk a little bit about MSM and TGW and some of the social context. Again, learning about what life is for MSM and TGW can help us gain a better understanding. So this slide, I found these terms in an article that was written in 2012. So I don't know if they've changed or if they're still used. Are they, positive or negative? So I'm going to be very interested in hearing from everyone when we get to the training. So take a few minutes, and look at this, and just a few things to think about for yourself. Do you think these terms are still relevant? Why or why not? Or are they used still? Are there different ones? Maybe discuss these with your colleagues. So if some of them are unkind or, might make someone feel bad if they were called that, pay attention to yourself and your colleagues, and maybe catch each other and remind each other that that's not a good word to use. So, help each other out with that. And then also keep in mind that a client or a patient might use a term, a word, when referring to themselves or friends who are also MSM or TGW, but someone else using it is not okay. So for an example, there's a word in the US that's called fag. It's also used in England and such, fag, which is a derogatory term if someone who's not a gay man uses it. So I can use it for myself, I can use it for friends, but someone else can't use that for me. So it's very, very insulting if someone calls me a fag that doesn't know me, is not my friend, and doesn't have permission to do that. So just think in terms of those things. I don't know if this is true in Vietnam, but in many places where I've worked, especially in the US and other places, is the question born gay or become gay? So are you born MSM, you born transgender, or does that happen? So nature versus nurture. Um, so basically, are we born gay and MSM or transgender, or do we become that? And then some of these things on this slide are some myths, and are they true or are they not true? So just a couple things. So that all MSM and TGW were abused as children, are sexually interested in children, are promiscuous or highly sexed, are un-Vietnamese or unnatural. So again, this comes from, I don't know that this actually is an attitude in Vietnam, but I think it is from what some of the things I read and some of the responses to the survey. But I did hear this in pretty much everywhere else I've worked, Uganda, South Africa, Nigeria, Taiwan, that it's unnatural to the culture of the country. There's a, belief or a myth that all are effeminate, not masculine, or, visibly identifiable. You can pick a gay MSM out in a crowd because of the way they look, or TGW. That we choose our orientation, that we're not born, MSM or TGW. So again, that's sort of nature versus nurture. That we're unfaithful, we're cheats, we're liars. Are failed heterosexuals, that we couldn't be heterosexual because we're inferior, and so therefore we are MSM or TGW. But I'll just, share this, that, I have worked with many, 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 many men and many, many, many transgender women through my years of 36 years of working in this field. And almost to a person, every gay man or every MSM that I know, have talked to, worked with, knew at a very, very young age that they were, they may not have had the words of, transgender or MSM, gay, but they knew that they were different. Same thing with transgender women. I have so many experiences with transgender women who, didn't transition till later in life, but said that they knew when they were 4 years old that they were not a boy. So for myself, I'm gay. I have always been gay. I believe I was born this way. And I can remember being very, very, very young, that I was more interested in men, like watching TV. I was just more interested in men than I was in the women. And it wasn't in a sexual way at that age, but it was in a, intrigued way. And I knew that I couldn't say anything. I knew that it would not be okay, even though I didn't have the words. I didn't really know what it was exactly. I knew because of societal pressure that I couldn't say that. So that's the experience that many, 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 many people that I have worked with have. So in terms of these myths and stereotypes, so some might be true, some might be based on reality. Um, you know, Most importantly is to not assume, and to learn from each unique person. So sexual identities. So let's look at some sexual identity choices. So we said a second ago that orientation is not a choice. So I believe this, and many people believe that, we're born with our orientation, but how we identify, we do choose. So how we identify is a choice. So there are the categories for MSM specifically, gay or bi identified. So there are people who are, gay, identify as gay or bisexual. And then there's non-gay identified MSM, and then situationally identified MSM. So, which is sort of part of non-gay identified as well. So gay and bi identified, basically could say they've accepted that they're bisexual, or they're gay or bi, or that they have sex with men and they're okay with that. It doesn't mean that they are out to everybody or open with it to everybody, but it's more of a personal internal identity. They've accepted that or chosen that and identified that way. So non-gay identified MSM may have sex with men, but not identify as gay or bi, or even yeah, mostly not identify as gay or bi. Um, number of, this can be from a number of things. So fear of being identified. So we talked about confidentiality earlier, or those societal pressures. We'll talk a bit about internal stigma in a little bit. So not accepting it personally, hiding it from themselves in a way, or not wanting to fully embrace it. They may think it's a phase and they want it to change, that it's just, oh, it just happened these couple of times, it's not going to happen again. Um, and they may identify as heterosexual and or fluid, or and that having sex with other men is just part of who they are, and they don't need to identify as gay or bi. And then situationally identified MSM, so it may be that when they're outside of their normal sort of life, like they're on vacation or on work on a business trip, and they behave differently in those situations. Um, or with certain groups of people that they know well and feel safe with. But they also may be heterosexual, and they may have sex with men for money, or survival or housing or drugs. So that's kind of, again, out of need versus identity or desire, perhaps. How these identities forms complex and influenced by many factors. Each person is unique, the process is unique, and it can be fluid and changing. So the moral of the story here is to find out how people identify and not make assumptions about how they identify. Okay. So how many MSM in Vietnam? I found quite a bit of information about this. So there's an estimate that there's 1 to 3% prevalence of MSM amongst men in Vietnam, and it seems to vary between urban and rural settings. Some of the differences may be that in rural areas where it's not as safe or not as accepted to be out, that someone who is MSM may not identify that way, even in a survey. So the estimate is a little over 250,000 men, and that's as of 2022. HIV prevalence for MSM is 13.4%. So that's high. And then men in general, it's only 0.5% for men aged 15 to 29. So the really large discrepancy there. In amongst MSM, it's quite large, clear discrepancy, and that's again why we're focusing here. So these are some comments that came from both a Vietnamese Reddit channel, and then also some are from the survey we did. So we developed a set of questions, and we did this in Taiwan as well, where we got them out to MSM and TGW to ask them what their experiences were just in general in society, but also in seeking healthcare, and specifically around HIV care and prevention services. So, you know, it's this is what I found and what we heard from people. So I'm going to just say that this is a segment or a sampling of attitudes. So one says, currently people are quite easy with us and have relatively neutral view of MSM and TGW. However, sometimes they still make some jokes on us and laugh. So again, as I said, like we hear these things all day, every day, and on TV commonly. Another person said, in urban areas, it seems a bit more open to families with easy access to mass media. In districts near the border, or in districts that have not updated much about gender and gender identity, there seems to be a lot of stigmas. Another person, if you have a strict parent, they normally don't give a shit, excuse me, if somebody else's kid is gay. But if you are, it will be a big disappointment. Disapproval, denial. In some cases, you can be expelled from the family. Vietnamese people care very much about the honor of the family. Having a gay son is a big disgrace. So this kind of speaks to, the culture, how culture, and, that it may be viewed as un-Vietnamese. There'll be some more responses that we can share during the training of trainers as well. So shared experiences of gay men and MSM, but also these are very closely aligned with transgender women and transgender men, because in many cases, safe places or the places where we meet and gather and support each other are inclusive of gay, bi, other MSM, transgender, male and female. So they're very similar experiences. And again, as I said, the societal pressures and the things we hear around us create very similar experiences. So one of the things is feeling different. Many of us know at a very young age that we are different, and when we're younger, before we know there's other people like us, we may feel like we're the only one. We are all alone. I can attest that I felt that way. So part of then what happens is we want to fit in. We want to be just like everybody else. So we find ways to hide who we are, to make sure we're not being effeminate, or if someone is a transgender woman and they're afraid to act like a woman or be seen to look like a woman because that's dangerous, then we find ways to fit in and to hide that, which creates isolation and loneliness. So as I said, especially when people are younger and or if they're living someplace where they don't see other people like them or don't have exposure through media or some other way, may feel very much alone. So there's compartmentalization, so hiding who we are, like I said, when it's not safe, or closing, even closing it off from ourselves sometimes. It can be stressful and exhausting. Dealing with stigma, as I said, it's all around us. The world is heteronormative, so heterosexual is the norm, and so non-heterosexual is not the norm, and there's always a feeling of being outside or targeted. Again, lack of support is very common. People feel unsupported. Partly, some of it can be that there isn't a support network around them. They don't see anybody else like them. And they feel alone, or they don't want to expose themselves so that they don't seek support. So fear of HIV and AIDS, many, many, many gay men, MSM, transgender women that I have worked with believe that it's going to happen, that it's just going to happen, that they're going to get HIV. Fortunately, with PrEP and with undetectable equals untransmittable, we can start to counteract that. So, it's not inevitable. Here's a way that you can, make sure that you don't get infected. So socializing through sex is kind of a common theme for MSM and TGW. Partly like men together, there's less inhibition, there's more freedom. Uh, I have heterosexual male friends who say, you're so lucky because, you don't have women that are limiting the amount of sex. And that's not saying anything negative about women. It's just that between two men, it's just easier. And in some ways, sex is less intimate. Like having sex is less intimate than actually having a conversation or getting to know someone really deeply. So it can be a safer way of connecting. We create families of choice. We create our new families, our chosen families that are supportive and loving and caring. So that's a commonality amongst again, through all MSM, TGW, trans men, etc. Many of us become social activists because the pressure and you know, one of the ways of coping is to fight back and to try to make change. Um, and for those who are not brave enough or are not able to be out enough to do that, the rest of us do it for them. So it's a community. And again, all of these experiences can be very individual and they might vary depending on where people live. Okay, so this is a little bit about transgender women. It was really hard to find much information, and I asked CDC Vietnam, and they're working on trying to get better figures. So in 2017, the Ministry of Health thought there were about 270,000 to 300,000 transgender folks in Vietnam. And then there was another survey I found online through the Asian Pacific Transgender Network that they were estimating more like 500,000. So it's not really clear, and it's not really clear what the prevalence is, and we will hope to have some more specific information when we get to the train of trainers. So again, attitudes in Vietnam. So this is towards transgender women. So again, some of this came from Reddit and from other online sources, and some came from our survey. So this was online. They say I'm neither a guy nor a girl, or worse, they say I'm gross. Even people passing by say that. So again, this speaks to, how targeted we can be out even in just walking on the street. And this is was a transgender teenager living on the street, male to female, so a TGW. So I don't know what her, appearance was or how she presented or anything. So this other quote is, MSM is okay, but TGW is still shy and hesitant to disclose because people still find it strange and lack information and understanding. In Hanoi, that's what we said earlier, that there's still a lot to learn. In Hanoi, transgender women still live in isolation and many transgender women choose to live in Hanoi because of the culture and customs in Hanoi. So I'm thinking that what they're saying is people still live in isolation and it's better in Hanoi than maybe in rural areas. Nowadays, men who have sex with men and transgender women in Hanoi live much more openly than before, okay? They can live as themselves, but they still live closed lives because outside Hanoi, there is stigma and discrimination. Self-stigma is still high as people don't want to come out to everyone yet. So as I mentioned before, again, people may not be comfortable, even in a healthcare setting, disclosing who they are. And another person says, where I live, people are quite comfortable with MSM and TGW. So the beliefs and attitudes are quite, they vary in a positive and negative. Stigma and discrimination. So we talked a lot about stigma and discrimination already, and we're going to go a little bit more deeply in that. So let's define stigma. We define stigma as a powerful discrediting social label. So again, the words that are used, it's labeling something or someone as bad or not normal based on who they are. So just think for yourself, what are some of the discrediting labels given to gay men or MSM and TGW? So again, we'll talk a little bit more about this in the TOT, but for yourself, think about that. We looked at that list of words before and just again, think about which of those are discrediting or potentially unkind. And stigma comes from a lot of different things. So people, I think as human beings, we have a natural tendency to be afraid of the unknown or cautious around the unknown. And so if we don't understand MSM and TGW, that it's kind of natural to be a little hesitant or a little fearful. That they're different, fear of the different, or so, like as we said, social and cultural norms create stigma, religion, and I'm sure there's other things that we could all think of. So prejudice and sexual orientation. So there are a number of things. So sexual prejudice, heterosexism, homophobia. Let me just get all these out here. Whoops. Here we go. Sexual prejudice, heterosexism, and homophobia. These are the sort of things around sexual orientation. So sexual prejudice is based on someone's orientation. So it really targets LGBTQ, MSM, TGW, anti-gay attitudes, basically. So sexual prejudice. Heterosexism, is, as we said, society is heteronormative. Heterosexual is right, everything else is wrong. So that create stigma against anybody that's non-heterosexual. And then homophobia comes from phobia, which means fear. So that it's like a dread of being in close proximity with homosexuals. So this fear that that we're predators. Um, we often call, a phobia an irrational fear. So with, someone who's MSM or TGW, it's not catching. So you're not gonna catch gay or transgender from someone. And my own personal belief is that a lot of this homophobia and fear comes from the person who is experiencing it, from their own insecurities. So they may be insecure about their own sexual identity. Um, we know that sexual attraction and identity is a spectrum. It's not this or that. And so, you know, people may have some level of concern about themselves. So the personal impact of stigma. So we want you to take a few minutes and think about a time that you felt stigmatized. It could be for anything, anything. So think about this. What happened? How did you know you were being stigmatized? What were your feelings about it? So what was your body reaction? What were your thoughts that came out? And how, if you were able to respond, how did you respond? Or how might you respond now if you had some time to think about it? So this is just for you. We'll come back to this in the training of trainers, um, and you won't have to, share this with anything either. So if you want to just stop the recording now and take a few minutes to think about this, that'd be fine. Otherwise, just let this rattle around in your head a bit. So stigma and discrimination, sexual orientation. Again, we've talked about a lot of this. So, it's not natural. Um, family and community rejection. So this is sort of some of the things that happen. There's a lot of pressure to produce grandchildren. One of those quotes was talking about how, that's what an expectation, and that's been very common in a lot of places where I've worked. So we said that stigma can come from outside of somebody, but we also heard from that one quote a little bit ago that stigma can also be internalized. So someone can have their own stigma and, have, negative feelings about themselves. So in that internalized stigma can cause people to hide, and being MSM, TGW, and HIV status, because there's a lot of stigma around that. They may feel guilt, internalize that, feel like they've disappointed someone, that they're not right, feel shame about having HIV, etc. That it can be very damaging to the individual, and it can be really hard for them to overcome. So anything we can do to help people manage that and not damage themselves further with it, that'd be really helpful. So, stigma is powerful. And one of the things that I think is really important for us as providers is to make sure that we are not contributing to it. So being, I guess, allies and making sure when we're working with someone, or if we're out in the community and we hear something negative, to say something about it and be an ally and try to help change people's attitudes. Okay, let's talk about social and sexual networks a little bit. So the social sexual networks have a number of attributes. So it's a really, really, really powerful way for people who are stigmatized to respond to that stigma. So by developing bonds with others who share similar experiences. Again, as I said, finding those safe places where we can gather, building our own chosen families, etc. So again, gay men and MSM have established communities and norms, so do TGW, and oftentimes they overlap. So this is another really important aspect about communities. They can include or exclude people, even within a targeted community, stigmatized community, there can be stigma happening within that community. So it's really, it can be by ageism or body size, a lot of different things, or how, if someone's effeminate or not effeminate. So there's a lot of things that, there are positive things about community building, and then there's still some of these things that are a little bit kind of not so nice. So it's really about seeking connection, accessing support, and knowing that a group of people care about you. And that can affect risk behaviors. So having connection and support can help reduce risk-taking behaviors, whereas not having that support can contribute to them. And again, as I said, TGW also have very similar community norms, community build community in the same way, and they very, very, very commonly overlap with MSM. Okay, so again, social connections we talked about. There is actually a online, I found a quote. It was, and I can't remember what it was from. I'll try and find it. That MSM and TGW, this is about Vietnam, share connections and often share the same places to gather. There are a number of organizations by and for MSM TGW, as well as bars and clubs where they can safely gather. So again, this was from in an article in Vietnam, from Vietnam. So so where they gathered. So we find each other in a lot of different places. So bars, private homes, clubs, restaurants, support groups, internet, apps. So, I'm sure you all know about Hornet and Grindr and Blued, at parks or outdoors and cruisy areas, public restrooms sometimes, adult bookstores, video booths, and saunas. And again, there can be a lot of overlap in the types, the different aspects of the communities. So, why do people have sex? This is, just a quick thing. So there's reason that people have sex. So, pleasure, commitment, to have children, to cope out of compulsion as a result of historical patterns and such as trauma, express a part of themselves. That's, we express ourselves that way. So it may be forced, it may not have a choice. So there's many reasons. Some are choice, some are not choices. Strategies for us as providers to improve our sensitivity. Let's talk about that. So asking better questions. So I mentioned earlier about the curiosity, and genuine curiosity is to be curious and find out more details about what's going on in the lives of the clients that we're dealing with. Again, in a sensitive manner, genuinely curious manner, that relates to the context of the setting you're working in. So one of the things that I like to talk about and especially this is super important for disclosure, self-disclosure coaching, is we need to know more about the context. If we're talking about a sexual partner, we want to find out more about, who the partners are, what's going on, what state of mind are people in when they're engaging in sex, where are they having sex. Those can all be really important and both for prevention, but also when we're helping somebody figure out how they can tell their partners about potential exposure. So using open-ended, non-judgmental questions, to get our clients talking, get them to be sharing. Some sample questions that are again, if we're working with someone, we don't know their identity, we want to not assume who they're having sex with. So we want to ask a question such as, do you have sex with men, women, or both? And again, saying that in a very non-judgmental, very even manner. Do you have sex with men, women, or both? No, like energy to it. Just sort of a call. I ask everybody this. And so there's some other questions that I think can be really useful. Tell me more about your partners. So that's just an open-ended way of letting the person tell you about and don't even have to say, do you have sex with men, women, or both? Just tell me about your partners. Where do you meet your partners? This can be really important, especially in terms of disclosure. Are they meeting them at a bar? Are they meeting them online? Will they be able to find them? How easily will they find them? If they meet their partners at a place they go to all the time, are they going to want to talk to that partner about, potential exposure? So there's all these things to be considering. You can ask things about, how do you identify instead of assuming? Even if a man says he has sex with other men, we still might not want to refer to him as gay, because that may not be how he identifies. Where do you usually have sex? Which is really important around in prevention to help problem solve about how people can be more safe depending on where they're having sex. And this can also be important around disclosure to, does this person know, did they go to the partner's house? So would they know how to find the house if they needed to? How are you feeling emotionally when you have sex? So what's going on? What's the feeling? Why, what's the motivation? What is the benefit of having sex? And then which partners are you most likely to use condoms with is a great prevention tool to then start problem solving around how they could maybe use condoms more often with other partners, or focus on those partners that they are able to use condoms with. Again, gets us more information, and it gets our clients talking. So here's just some things for you to think about. What can you as an individual in your role do to improve sensitivity to MSM and TGW? So just think about this for yourself. What can you do personally in your role? What can you do to advance this sensitivity work in your organization or facility? So how can you advocate for others that you work with to also build sensitivity? Oh, I'm not. Okay. And then here's another quote this is from a transgender woman, and in an article I found, who says, I think there should be more training for doctors and nurses. Before they graduate, they should have taken at least one course on gender studies. So, again, acknowledging that, there's a lack in training, et cetera, and that's really important that we change that. And so remember back earlier, we talked about the woman who said that there's just still a lot to learn, that healthcare for transgender people is still such a new thing. Yeah, so we have some work to do. We heard from people who talked about some negative experiences, but we also asked them about positive experiences. So in the survey, we asked them to tell us what worked or what was good. So the one person said, I see at SHP, I don't know, I think that's a specific clinic or something, has a client satisfaction survey. So if you are not comfortable, you can completely give feedback to the clinic. So what a great tool to encourage and ask for feedback. Another person said, service providers must have empathy, expertise, and responsibility. There should be an independent third-party review to improve service quality and incorporate into routine standards of practice. So again, some qualities that providers are good to have, and this person would like to see more of. Another person said, most of the HIV services I use are at community-friendly clinics like Gallant Clinic. So I find everything very okay and reassuring. So again, something's going well. Find out what Gallant Clinic is doing. They're very community friendly. Some other things, a couple other things that came up. So need better counselors, build capacity for community outreach workers. So again, training and helping people gain understanding and sensitivity building is important. Improve service quality, diversify HIV-related healthcare services, friendly and open with clients. So they want a welcoming, friendly, open place to go. The last person says, for me, medical staff need to respect privacy. When communicating, feel as comfortable as other clients. So I believe what was being said here is, if someone does not want to disclose, and if they're working with someone who's MSM or TGW, to treat them like everybody else and not show any discomfort. So here's just a couple things that I want to almost leave us with. So building sensitive services. So every MSM and transgender needs the following: a risk assessment. So really an attempt to understand exactly what's going on, in terms of their HIV or STI risk. Sexual health assessment. So how are they doing otherwise sexual, and they're having a healthy sex life. We want people to have healthy sex lives. Mental health assessment. There we go. Risk reduction measures. So help them find ways that they can protect themselves. An HIV assessment, obviously. And then addressing very specific treatment concerns. So if they are positive that, or could be around PrEP. And everybody deserves to be treated with respect, right? So these things are really important for MSM and TGW, but they really pertain to all of our patients and clients. The thing is that often MSM and TGW may not get them done as well or in the right way, as heterosexual people do. Okay, remember we talked about this earlier. So rating yourself 1 to 10 on sensitivity. So we went through a lot of content. How do you feel now compared to how you felt in the very beginning of this session? So yeah, there we go. And so then again, on a scale of 1 to 10, rate yourself now. Again, if you needed to be different for MSM and TGW, make a note of that. And then taking it a little further, what can you do to move 1 point up the scale in your sensitivity in responding sensitively to MSM and TGW? What can you on a personal level do? 1 or more points. You can jump more if you'd like. And my last thing for you is, what will you what will you stop doing? What will you start or continue to do to be more sensitive in your work with MSM and TGW? I'll leave you with that, and we will revisit this when we see each other at the training of trainers. I want to thank you, and I'm looking forward to seeing everyone in April in Ho Chi Minh City. And again, I'm Greg Melhoff, the California Prevention Training Center, a program of the University of California, San Francisco. Thank you all for your attention.